Hmm? Anytime? Anytime? Okay. Good morning, everyone. My name is Derek Fox, and I'm the Grand Chief of Anishinaabe Nation. I come from Bearskin Lake First Nation and reside here in Thunder Bay. I'd like to welcome our NAN Health Transformation Lead, Alan Fiddler, and our staff and our health experts who are here in the room. I'd like to acknowledge that we're on Fort William First Nation, home of the Ojibways. So we are here today in a show of support for Grand Chief Allison Linklater. We are also here to support the Mushkegowuk chiefs who are currently in Ottawa at a press conference calling on the governments of Canada and Ontario to include Mushkegowuk First Nations in the budget discussions for healthcare. For those who don't know, NAN is comprised of 49 First Nations across an area that covers 2/3 of Ontario's landmass. There are 4 main languages with many distinct dialects within our First Nations. 31 NAN communities exclusively rely on the winter road system or air to get to urban areas. 8 communities in NAN also belong to the Mushkegowuk Leadership Council. So we fully support Grand Chief Allison Linklater in her efforts to be included at the table for discussions around healthcare budgets with both the province and the federal government. The NAN communities are in crisis. I am constantly hearing from chiefs about the challenges to their community members face with accessing health, mental health, the number of suicides, lack of housing and infrastructure, lack of clean drinking water. Mushkegowuk has the longest boil water advisory in Canada, located within Anishinaabe Nation. These are just some of the challenges that our leadership face. It makes it difficult for our communities to move forward on their important issues such as food security, protection of the environment, resource development, job creation, when leadership is constantly shifting focus from one crisis to the next. If any one of us here in this room has a medical emergency, we can go to the hospital and get help from a doctor. For our community members, it takes various and multiple steps, sometimes for 4 or 5 people just to see a emergency room doctor. It can take days to get emergency treatment. For example, if someone in Fort Severn needs to travel to Toronto for treatment, this is about the same direct distance by air, not including layovers, for someone from Toronto to travel to Sydney, Nova Scotia. Our community members need rapid access to services closer to home. Simple appointments can take months. And if something happens, like a flight being delayed or canceled due to weather, and the appointment is missed, it can take months of waiting for the next appointment. In general, our community members get a later diagnosis of diseases, often in a more serious state, which in turn takes longer to treat. with more intensive treatments, with overall poorer outcomes. In recent news, we're hearing about the doctor and nursing shortages in Southern Ontario and closures of some emergency centers. This has been a common occurrence in Anishinaabe Nation and Northern Ontario for many, many years. Building health centers and having more doctors and nurses in communities is and will be a bigger part of the solution. We definitely need more infrastructure, but we also need to consider healthcare needs in our communities. Ultimately, the best way forward is to have governance over who delivers healthcare services and how those healthcare services are delivered to our First Nations. It is not an understatement to say this is a matter of life and death. During the COVID-19 pandemic, former Grand Chief Alvin Fiddler, who is here with us today, as I said earlier, can attest to the achievements that happened as a result of two levels of government working with us. When NAN was able to work together with the federal government and the province, we were able to come up with vaccines very quickly and efficiently. And great things occurred, great things happened. They were able to set up makeshift treatment centers and get healthcare workers up to communities during those outbreaks. When mental health workers weren't allowed to travel to communities during the pandemic, NAN Hope was created. NAN Hope provides quick 24/7 mental health services in Cree, Ojibwe, Ojibwe over the phone. And it provides navigation for ongoing mental health and addiction supports. Throughout the pandemic, millions of dollars in equipment and supplies were provided to health authorities in the region. NAN saw the dedication to 50 public health nurses to the region. There was pandemic capacity within our communities where none had existed before. There is no doubt that through a trilateral process, this can work. This can save lives, and it did save lives. We have demonstrated that we can come up with solutions that not only directly benefit our community members, but will get rid of that red tape. And in the long run, reduce the costs of healthcare delivery. In 2016, we knew that healthcare delivery for our First Nations in the current system was not working. That year, we started discussions with the two levels of government, which led to the signing of the Charter of Relationship Principles governing healthcare transformation in the Anishinaabe Nation territory. The Charter expresses a tripartite commitment to develop and sustain a renewed relationship that is a partnership, to result in immediate, medium, and long-term transformative change to the existing health system at the NAN community level. Right now, the Prime Minister is meeting with the premiers behind closed doors to discuss funding for healthcare delivery across the entire country. The premiers are requesting long-term permanent funding, which is something that NAN First Nations require to do the work under health transformation, not through a program-based, project funding-based model, which is how it's currently operating. We should be there. NAN should be there. Mushkegowuk should be there. First Nations should be there. The Prime Minister is meeting today with the premiers. Will talk about transforming the healthcare system across the country, and it will affect future negotiations and funding. We already have an agreement to move health transformation forward with both levels of government. But they are making these 10-year plans without us. We have demonstrated that when we work together, we can come up with real solutions to real problems. Grand Chief Allison Linklater needs to be at that table. We all need to be at that table. We should not be an afterthought. So I do envision a time when our First Nations do have access to appropriate healthcare that resonates with their needs in a timely way, and where First Nations healthcare delivery, and where First Nations have direct healthcare delivery for their community members. Finally, I am looking forward to the response on both levels of government, and I am looking forward to working with our federal and provincial partners on our healthcare needs. Thank you.
Miigwech, Grand Chief. Good morning, everybody. Thank you for coming here to hear our message. And it's a message that we are delivering on behalf of our communities in the Athabasca Nation. Grand Chief Fox, I think, delivered a good summary of why we're here. And the fact that we've always been treated differently for who we are. That's why we started the health transformation work 5 years ago, that we need to dismantle and decolonize these systems, and in this case, healthcare, that, one that is colonial and racist. And we've always been treated differently. For example, I always tell the story that I was born at an Indian hospital in Silicon, and we still see remnants of those two systems today, even today. And the fact that we are not inside the room, we are outside, I think says a lot. And that's why we're here today, to remind our government partners of the agreement that they signed with NAN in 2017, that in order for all of us to fix the system in our communities, we need to be there. We need to be active partners in the work. And that's why we're here, echoing the call again, and echoing the call that is being issued today in Ottawa by Mushkegowuk leadership, Chief Gaius Wesley of Saskatchewan, and Grand Chief Allison Linklater, and Mushkegowuk Grand Chief. So I commend the leadership that are rising up today. I saw the AFN press release this morning as well, that even our national chief is not being allowed in, and that shouldn't happen. If the Prime Minister is serious about reconciliation, his message around that the most important relationship that's important to him is with the Indigenous people, it doesn't show, like his actions speak otherwise. So that's why we're here. If anybody has any questions for us. We'll have a release out, and maybe the Mushkegowuk will do it. Yeah. Okay. I see.